All right, so good morning, everybody. We're going to be kicking off this month as Mental Health Awareness Month, being talking about mental health, and we have some programs here that really feature and highlight mental health and substance misuse and various programs to really help veterans in the community. I do want to start off this morning with a moment of silence. Yesterday's devastating news in Texas with the elementary school was, I think, really heartbreaking for many families and feeling really widespread across the country. And just a few weeks before that, with the news in New York. So I'm just going to have us pause and just have a moment of silence to think about those families and the loss that they have right now. Thank you for that. And knowing that this month is Mental Health Awareness Month, I think there's so much that we can do to kind of talk about ways that we can help our veterans that may be struggling with mental health. And we have some great resources here to share about their programs. And so with that, I do want to kick off as we get started, a little bit of a recap from last month's meeting. Last month, we featured some more discussion on employment resources, and we featured Maryland Department of Labor and IVMF's Onward to Opportunity program. We also had a really motivational activity by Dr. X, who we've invited back for this meeting to share some more motivational time and opportunity for us to network and get to know each other. And we also have received some feedback during the meetings on topics for future meetings. So a lot of that's really helping us to line up what we're going to be doing moving forward for these meetings. And we'll be sharing at the end of the meeting the game plan for the next couple of months. And so with that, I want to do just a brief review of Serving Together. And as we think about resources that are available in the community that can really help connect folks to the needed services that they have in this region, and want to provide just a brief overview of Serving Together. So who we are, we provide a lot of care and human-centered holistic support towards our military veterans and their families throughout Northern Virginia, Washington, D.C., and Maryland. We help them access a wide range of resources across the region, across the community. Not only are we serving the military and veteran population, we're serving the organizations that are working with and supporting them. And that's giving you guys the voice to really share, network with each other, and communicate. And it's all about helping to bridge some of that cultural competency gap that's out there to help our community better understand the needs of our military and veteran population. So we do that through these collaboratives. We provide community education and a lot of capacity building in the region. And so with that, I just wanted to provide a quick introduction to our Serving Together peer navigators. I invited Darrell Jennifer to join our call today to introduce himself and share a little bit about himself, so you guys know whenever you're referring to Serving Together, who you're connecting your veterans to. So Darrell, are you available to say a few words?
Yes, good morning, everyone. Thank you so much, Christy. I am Darrell Jennifer. I am a veteran and family peer navigator with Serving Together. I've been with the team for about a month and a half now. It's been a really great experience. I am a U.S. Army veteran. And I have about 6 years now experience in the health and human services field. I've worked with foster children. I've worked with the victims of domestic violence and human trafficking. I've worked with the homeless population. And now I've had the opportunity to serve and work with veterans. So I'm really excited. I will try to drop my contact down in the chat box. So if you guys see me around or see me in the system, or please feel free to reach out and shoot me an email or call at any time. I'll be happy to speak with you guys.
Awesome. Thank you so much, Darrell, for joining us this morning. I appreciate you sharing your contact information. And feel free, I know you've got a lot of things on your plates. If you need to drop off, no problem. We appreciated you coming in and sharing a little bit about yourself.
Thank you so much.
Awesome. And just so you guys know, we do really provide that human connection for our veterans, helping them connect to resources. And our peer navigators go through extensive training to make sure that they can serve our military and veteran population. And I'll share a little bit more this afternoon just on how you can connect with our team and how you can refer to us. But before we kick it over to Dr. X, I do want to have everybody start putting their information and provide introductions in the chat. So please share your name, your organization, and maybe a little bit about yourself in the chat so we can get to know each other. And then we'll be doing a little meet and greet activity that I'm going to launch over to Dr. X to lead up.
All right, fantastic. Hey, I'm Dr. X, retired Air Force, Lieutenant Colonel, Air Force Academy grad. And over my shoulder, you'll see an acronym, MESS UP. As you know, if it's not an acronym, it does not exist in the military. So I'm all about acronyms. Well, MESS UP is an acronym for mental, emotional, spiritual, social, universal, and physical. So with mental, it's all about your core thoughts. With emotional, it's your core emotions, your core feelings. Spiritual, your connection with a higher being. Social, your connections with others, family, friends, you name it. And then universal, how is your universe set up in terms of your space, your environment, and your time? And then the P is for physical, how are you physically well? So in this quick exercise, in 30 seconds, I need to know, what you want to share with us in terms of, what you do or whatever you want to share. But of those 6 pain points, which one is yours? So in 30 seconds, let us know what you want to share and let us know also which one of these 6 pain points is your pain point right now. So we're going to go with Darrell and then Stan.
Hey, Dr. X, can you go through the pain points again? I think a lot of people were just running through their chat stuff here too, simultaneously.
Oh, got you.
Thank you. I was going to ask that too. I'm like,
Yeah. So mental, emotional, spiritual, social, universal, and physical. Universal is one that you may not have heard of before, but that is how is your universe, your personal universe set up in terms of your space in your home or in your office, your environment, where you live and your work environment, as well as your sense of time management versus decision management. So with that, 30 seconds, go. Darrell and then Stan, over. Darrell, you're on mute.
Yes. Okay. And we have to choose one?
Or more.
Or, okay. I would say mental, emotional, definitely spiritual, and physical.
Okay. All right. Thanks. Stan and then Kim.
I would have to say mental, emotional, spiritual, and social.
Got it. Kim and then Ann.
I would say physical, emotional, and spiritual.
Okay. Ann and then Matt.
Well, because of what happened in Texas last night, I think it's everything. I feel pain everywhere because of that. So maybe that's a universal covering.
Good point. Matt and then Yolanda.
Definitely all of them. Every day impacts you a little differently every day. So yeah, definitely all points there.
Okay, thanks, Matt. Yolanda and then Sandra.
I would have to say universal. Our house was painted yesterday and it is a hot mess in here as I put my office back together, but universal as well as to what happened last night. I had to stop what I was doing and not do a couple of things last evening. And then physical, I just need to move around just a little bit more. Thank you.
Thanks for that. Sandra and then James. Sandra, you on mute? You unmuted, but we can't hear you. We'll come back to you, Sandra. Let's go with James and then Mary.
Good morning. Can you hear me?
Yes.
I would say universal.
Okay. Thanks, James. Mary, and then back to Sandra.
Yeah, I'm with James, universal.
Thank you. Sandra? Yeah, it's not coming through for some reason. Let's go with Jennifer and then Mallory.
Hey guys, good morning. Thanks for having that moment of silence, Christy. That was really important. I just wanted to say thank you for that. I would say universal for me, and always for me. If I don't feel in balance, I don't feel balanced anywhere, at work, at home, in my relationships. So it's a personal struggle for me to find balance.
Thank you. Mallory and then Justin.
I'm driving right now. Can you hear me okay?
Yes.
Okay. I think I feel similar to everybody else right now with kind of the news last night. I think, and the balance that the last person just said, I kind of just am feeling it just like everywhere, mental, physical, emotional, like it all ties in just a little bit. So I would agree, like my pain point just right now is like scattered everywhere.
Thanks, Mallory. Justin and then Cynthia.
I agree with everything that everyone is saying. I would say mostly right now, emotional and spiritual.
Thank you. Cynthia and then Shaquan.
Mental, emotional, spiritual, and physical. Physical, because whenever the rain does this, my body in old army tricks act up. Mental, emotional, and spiritual. My dad is having some complications after what should have been a very routine hip replacement. So having to manage all that from here while he's back down in Texas. And actually, when he called me last night, I thought, oh my gosh, what's going on? And it was to tell me about what had happened down in Uvalde.
Wow. Okay. Thanks, Cynthia. And last but not least, Shaquan.
I would go with the universal as well, only because all systems impact each other. And if we're not, I would say, at a state of equilibrium in one, it could affect the others. So definitely just having balance in everyone. It won't happen every day, but definitely coming from a universal standpoint. It also impacts how we show up for our clients and our agencies, because we may be impacted by the trauma that they face. So definitely a universal approach.
Yeah, thank you. Thank you. Absolutely. And Christy, I didn't forget about you.
Thanks, Dr. X. I agree. I think right now I'm in a lot of emotions. Emotional for me right now is the biggest pain point, I would say, but I agree. I think there's different levels at every point in my life. And I know what you're going to add on to this, but I think it all kind of falls back to your mental state. So I'll turn it back to you, Dr. X.
Yes, absolutely. Absolutely. The point of this short activity is to let you know that it all goes back to mental health. This is Mental Health Awareness Month, and all of the physical and emotional, spiritual, it all starts with a core thought. And it's a tough time in our world today. But if we can tweak our thoughts, if we can come up with more resilient ways to cope with what's going on in our lives, we will be better for it. So that's all I have. Over to you, Matt.
Awesome. Thanks so much, Dr. X. It was very moving, very motivating, and setting up everything for the day. So I appreciate everything that you've done here this morning. Christy, you as well. So thank you, everybody, for attending today. For those of you who do not know me, my name is Matt Gryskewicz. I'm the Director of Community Engagement for the Headstrong Project. So as the steering committee was kind of setting the stage for the next few months for this collaborative, we were just kind of wondering, as the world kind of resumes COVID, we wanted to check in with everybody's mental health around possibly doing a hybrid or an in-person event. So we have a poll coming up here. How comfortable would you feel attending an in-person meeting for next month? So going ahead, select those options there. Well, one option, I should say. So go ahead, take your minute here and select which option you would be okay with. Again, it's all to just kind of recognize COVID is impacting our mental health, and it impacts our well-being, it impacts our physical health. So before we jump into anything, let's really just get a test and a gauge for you guys, because we definitely want to have your input as well.
We'll just give it like 10 more seconds.
Yep. There we go. All right, so this is good to know. This is good data for us to see. You know, most of us are okay with doing comfortable or doing an in-person service or get together here. Some of us, you know, about 20% would say, not right now, but maybe later. Of course, if we do something in person, we could pursue a possible hybrid model as well. We could also, I mean, we're always going to be at the whims of COVID anyways, you know, with some spiking happening throughout the nation. We just kind of have to watch it anyway. So thank you everybody for completing this poll. It helps us kind of gauge where we need to go forward here. So again, like everybody has mentioned, today is this month is Mental Health Awareness Month. So we have a waterfall question. For those of you who are familiar with these are always fun to do. If you're not familiar, this is simple. This is going to be the question here. Think about your answer. And the question is, what do you hope to get out of the discussion today? Do not put it into chat yet. Stand by on that. So go on ahead, tee it up, get it ready in chat, but don't hit submit or send yet. We'll give it about 30 seconds here, and then we'll tell everybody to submit it at once. So go on ahead, put it in chat, but don't submit. I'll give you the go ahead when we're ready to go on ahead and submit. Give everybody about 30 seconds here. Everybody's nonverbals, they're dying over the anticipation. So go on ahead, release them into chat. Let's have fun with it. Let's see what we come up with. All right, Christy, you want to help me filter through these here?
Absolutely. We've got, although I put it in, excited to learn more about the programs, their most qualified candidates to refer to them, information regarding legal help for vets, a better understanding of resources for referral, learn something new or different about the two programs I'm familiar with, ways to become more resilient, and discussion and resources. Awesome.
Excellent, excellent. And Shaquan notes, increase awareness of the various agencies offered to our population of clients as well. Very good stuff. So yeah, I think a lot of these, or some of these, we're definitely going to cover today. You know, we're definitely excited to have, you know, MCVET and Baltimore Station present and discuss a number of things. And then of course, ServingTogether as well, going through about what you guys do, bringing the human-to-human interface, which so often impacts one's own mental health as they navigate the complexities of the resources in the community. So very good. Lots of good stuff. If anybody has any other thoughts about what they hope to get out of today, feel free to put it back in the chat. And even if we don't cover it today, this gives us ideas on where we need to go in the future as well. So please be open. We want your feedback. We want to know what you guys want to know. That way we can bring those supports to you all. So with that said, we'll kind of get into our panel overview here. So I'll hand it over to Ann. Ann, up to you, ma'am.
Well, I just want to leave time for our panelists. And, you know, the format of this is they get to talk for about 3 minutes, a 3-minute kind of elevator pitch about what they do, how they do it, and really how to refer to their program so that the case managers and direct services know how to really help their clients connect in a real active way and not just hand them a passive brochure and say, you might want to check out, MCVET. So I don't know who's going first, but I'd like to just pass off the mic to who's ever has the first slide.
We're going to have MCVET go first. And so Shaquan, I think we're going to turn it over to you if you're available.
Yes, I am available. Good morning, everyone. Once again, my name is Shaquan Winnigan. I serve as a case manager at the Maryland Center for Veterans Education and Training, also known as MCVET. We are located in Baltimore City, near downtown. Most of the time with our veterans so just to give you a brief overview of the services that we offer. So we offer in-house certificate programs such as substance use, case management, job employment, and referral. And we also connect with other agencies in regard to mental health services because we don't offer mental health services in-house. We have we partner with funding sources to help our students go to trade school. Well, we have an outreach coordinator. His name is Paul Konevsky. What you would do is you would contact MCVET. Paul would then do a screening. Most of the time, to be a candidate of our program, the person has to have served in the military, reserves, National Guard. Any type of discharge is okay, and you have to be homeless. We conduct a screening, a general screening, and we have the veteran come in from wherever they may be located, Virginia. Some of our clients are from North Carolina. We help them to address any residency problems, and if they need to relocate, we offer transportation to them as well. If in doubt with a client, we let Paul determine if the veteran is a good fit. Our goal is for the referring party not to have to worry about if the client is a good fit. We allow our outreach coordinator to do that. And also if any other questions need to be asked, we collaborate as a team to determine the services needed on a case-by-case basis. So we just keep it really general. If we are unable to serve that veteran, we do look for the veteran to have somewhere else to go. So we have other veteran agencies that may take the client based on their acceptance or what they require or see fit for a client. But most of the times we accept any veterans as long as they are not a harm to themselves. They have to be willing to seek mental health services if it's severe. We collaborate with the Baltimore VA and also with affordable behavior consultants. They're located actually inside of MCVET. So if a client is not VA eligible, I'm pretty sure we all know what that means. If not, then if they can't seek services at the VA, then we help them to go to a civilian place to get mental health services. We may screen for symptoms. We do a biopsychosocial as a case manager. So after Paul completes an intake, and if that client is accepted, most of the times they are, depending on your discharge would depend on if you're eligible to receive VA services. After that, most of the time our clients are well-versed and they're able to get housing, employment, job readiness, and also just seeking the overall services that they need. So that's a little bit about MCVET. So that's it for me.
Thank you so much. And we can Stan has a question.
Does MCVET have an employment program for just veterans?
No, nope. It's actually, so you do not have to be a veteran at MCVET or a client at MCVET to receive the job training program. We do deal with external clients in the community. We partner with major communities such as like Reach Partnership, and we bring them in. They come into MCVET 5 times a week, 1 to 5 p.m. They receive the training that they're interested in or in the training that they sign up for. So it's well-versed. Anyone from any agency can actually come over to MCVET, and you do not have to be a veteran to receive job training. Thank you for that, Stan.
And keep your questions, on a sheet of paper or however you log them in your brain, and we'll have the next speaker go, and then we will open up for a discussion. You can ask a lot of questions around different types of services and referrals and other topics. So who's up next?
That's me.
Hey, Kim.
Hi. Okay, so somebody watched my time because I'm sitting here, I'm like, oh my God, how am I going to do this in 3 minutes? So
Just watch your chat. I'll pop in a 1 minute warning and then when your 3 minutes are up.
okay, thank you. Okay, so my name is Kim Kaleri. I'm the Deputy Director here at the Baltimore Station. And briefly, we've actually been around for 33 years. We have 2 facilities in Baltimore, one South Baltimore and one in West Baltimore. And so we have 3 programs that we offer to the veteran community. We have a clinical program or residential program where veterans can stay with us for up to 2 years. We also have a service intensive transitional housing, which is really workforce development. We have that program, which is also residential. And then we do have an outpatient and intensive outpatient program that is run through our West Baltimore location. We do not charge any cost to our clients. We don't take their SNAP card away when they come into the program. We want them to focus 100% on their recovery. So no fees are charged, no rent is taken. As I said, we really want them to focus on their recovery. Similar to MCVET, we will take a veteran from anywhere in the United States. We will work closely with the local VA or hospital to pay for the transportation to get that veteran here. Our ideal candidate is, so we serve only men. They have to be homeless, a veteran, as I said on the slide, 18 years and older, have a substance use disorder, and unemployed. We cannot take anyone who has any type of sex offense or arson. So those are really the only two things that we can't accept somebody into the program. So while men are with us, as I said, they live with us, they can stay with us in both the SIT program and clinical for up to 2 years. What we do find is that the workforce development program, men are with us probably like 8 to 10 months, and then they move on to employment. So while they are with us specifically in the workforce development program, we are providing them with everything they're going to need to sustain their income. So that could be resume writing. We have volunteers who come in and take, that military resume and convert it to a civilian resume. Case managers work really hard with these veterans to identify their strengths, their skills, and what makes most sense for them in employment, because maybe where they were before might not be such a great place to go back to. So we really hone in on what those skills and talents are. Again, we do interviewing skills. Thanks, Cindy. We work with local businesses and organizations to set up internships, training programs. M&T Bank comes in and does a financial literacy program. We work with the Maryland Multi-Housing Association, who does a monthly rental program for us. So really just equipping our men with everything they need to graduate and lead a life of recovery, but also a sustainable income. Referrals come to us primarily through the Veterans Administration. We also do get referrals from hospitals, emergency rooms, other service providers. We do have an outreach coordinator as well, who's a graduate of our program. I'll put his information in the chat because that's really your first point of contact here at the Baltimore Station if you do know of a veteran who is in need of services. And James will get to that veteran, and typically if they are a fit for the program, we can get somebody into treatment and into our program within 24 hours. So that's it. I'll stop.
Yeah, and I'll open up for questions. I do have a question first to kick off. And just for everyone, I know that this was originally a panel around kind of employment services, but you guys offer so many other services, mental health, housing, et cetera. So feel free to ask questions about the array of services these 2 organizations provide. And just if you're struggling with general resources, these organizations might know other resources in the network. But simple question first, you both serve individuals who are homeless. Like that has to be the requirement of all of your services. What do you mean by homeless for both organizations?
So with the Baltimore Station, you have to meet HUD's definition of homeless. And I apologize, I don't know what that is off the top of my head, but you have to meet HUD's definition of homeless for our program.
You do not, for MCVET, you do not have an address in which you reside. For us, you're considered homeless if you're sleeping on someone's couch, if your name is not on that lease. So yeah, that's what it is for us. As long as your name is not on any lease, that you're not housed under a HUD-badge voucher. Some of our clients come literally off the street, so it really just depends on the client.
I do see some questions in the chat that we can start with, but feel free to just unmute and ask. Stan asks, does MCVET have room for women veterans?
Yes, so MCVET houses both men and women. The women are housed in SRO, that's single room occupancy. It is considered permanent housing. You can stay there for up to 2 years, that's the goal. And the men are housed in emergency shelter for 72 days, transitional housing, and then they can move into SRO depending on their living situation or whatever their background may be. We do not have limits to sex offenders. We do take sex offenders as long as their offense is not towards a child, because we're around schools. So yeah, we house both men and women.
And for those who are just joining, feel free to jump in with questions around services from MCVET and the Baltimore Station, and any questions you have on resources in general that this crew can help navigate. Okay, so feel free to come off mute and ask some questions.
I've seen a capacity question. We house up to 120 veterans. So
yeah, and we typically serve between 300 and 350 veterans annually between our two facilities. Our South Baltimore facility can house 90 men, and then our West Baltimore facility can house 40. And then we also have 2 row homes that we just got a capital grant from the VA, and we are going to convert those 2 townhomes. They are right now congregate living. We're going to convert them into SROs, and 10 veterans will be able to reside there.
Awesome, thanks. Stan, you got a question? Going ahead, man.
Thanks. Both programs, you have a limit on how long they can be there. That's understandable. When you're trying to find them a place to stay after their time, is that a problem at this point in time? Is there a rent issue, yada, yada, yada?
We haven't experienced any issues in finding placement.
Okay, thank you.
I'm going to be transparent. It is a struggle because every client has strengths and they have barriers, meaning they can have barriers related to credit, barriers related. I'm sorry, can you hear me?
Yes.
Okay, they can have barriers related to debt. So we definitely dive into budget and planning. As a case manager, we do budget and planning. We retrieve credit reports. We help them strategically as a human being. And if they can qualify for housing on their own, then we go the normal route of applying. If they cannot, then we find affordable housing for them. The goal is not to push you out, but we also set a goal with our clients for 6 months to 1 year. If you're meeting with your clients on a every 2-week basis, depending on where they are in the program, then you can monitor their progress towards housing and determine. So it's definitely on a case-by-case basis. Some clients get housing faster than others, but it also depends on their if they have resources available to them.
One thing that we have experienced is that when our men, so right now, I think 10 of our men just got their HUD-VASH vouchers, and they're not ready to leave the program, but they're so afraid that they're never going to get that opportunity again. So again, kind of along with Shaquan was saying, you know, we really, again, on an individual basis, we really work with these men to make sure that they understand, you know, kind of, we just want to make sure that they're ready. And what we do find is several times when this happens is they'll get their voucher, and then in 3 or 4 months, we see them back. because they're just not ready to be on their own yet.
Yeah, and to piggyback off of Kim, it could be due to substance use.
Yep.
Some of our clients have a long history of substance use, and sometimes their housing turns into, we don't even know. And I just feel like that's why we have an external GPD program. And as long as that client is not receiving a HUD badge voucher, they can get external case management services, meaning everything that we offer internally to MCVET, you can receive that in a community. Our case managers do community case management instead of in-house case management. So it's really like a wraparound service. You can still come back to MCVET. So we try to keep our clients connected, whether they're housed through HUD or not.
Same with us. We're very similar, as everyone's probably figured. And I think the nice thing is that between MCVET and the Baltimore Station, we actually cross-refer. So if someone is not a fit for our program, but we know that they could be successful at MCVET, we will refer a veteran to their program and vice versa. So, so again, to piggyback off of what Shaquan said, we also do, we offer community services, inpatient and outpatient. So a lot of our men who graduated within the last year and a half are now coming back to get services, which is terrific. And, our population, especially kind of going back to the housing situation, for them to be in an apartment or in a house by themselves is not a good place for our men. They need to be in a community. They need to be supported by other veterans. The isolation, especially with that substance use disorder and the mental health challenges, is just not a good place for them. So, yeah. And I saw somebody, was there a question, I'm sorry, in the chat about volunteers? I think I saw something about volunteers. The Baltimore Station was founded by 3 women in South Baltimore. So as we've continued to grow and expand, we've been very purposeful in making sure volunteers are a key part of our organization. We have over 2,500 individual volunteers who come in and serve meals. They do in-kind donation drives, service projects. We're now finally able to get kids back in and do community service hours. We really couldn't do what we do without our volunteers. And we will accept. I think what differentiates us from a lot of other service providers is that we actually will allow children in the facility. 16 and under do need to be supervised by an adult or a guardian. But our men are going to be, out in the community. They're going to be your neighbor. So while they're with us and under their care, we want to expose them to the community, have the community come to them so they can get to know them. And we have volunteers who have been with us for over 20 years, and they really form a bond with our men. And volunteers help tremendously with our men's self-esteem and self-worth. At least once a week, I hear, a resident will say to me, like, this company is here for us, and they're doing a trivia night for us. And so it really helps in so many ways. So we love volunteers.
And I see, I think someone's here from the Veterans Treatment Court, which is great. And also the Transitional Housing Village. There's a lot of social service organizations on the call. I was just wondering, from anyone, what barriers are you really seeing with the veterans you serve, if it relates to employment or mental health, since this is Mental Health Awareness Month? If you have any questions for the speakers or just sharing resources generally with the group.
I will say that we have seen I don't know what the percentage is, but a tremendous increase in mental health challenges before the pandemic. And obviously now with the pandemic, it's just, it's skyrocketed. And we made a decision a couple of years ago to bring mental health in-house. So we have, and we're actually hopefully going to partner with Matt at some point and Headstrong, but we have mental health in-house so that our men can just literally walk upstairs and go see the mental health therapist. They don't have to go to the VA. They don't have to get on a train. It's all right where they are. convenient, and we have seen tremendous results from having that in-house.
Yes, just to piggyback off of Kim, that's definitely the same. I would say it's definitely been a spike since COVID. The only barrier I would say to mental health right now, yes, we have in-house mental health services, but at the VA, they're kind of, backed up. So they're not offering individual therapy, and it takes a while to get our clients scheduled. So we definitely always make sure that they have a therapist that's following them. Medication is not always the answer. Some clients really just need that therapy. And I feel like that's what we lack, not even just in general, we lack therapists in the field. So it's kind of hard to get our veterans connected with who they need to be connected with, because it may just be group therapy offered at that time, or they may not be able to be seen as much as they need to be seen. And then some insurance barriers as well. But most of the time our clients are able to be seen, they're able to be medicated, just making sure that they're not resistant to the treatment, because a lot of times some clients may not know that they're actually going through certain things until you are able to clarify and help them to reflect on what they're going through. So it could be some resistance to services because of past experiences. So just definitely helping them to see that mental health is definitely key to helping you restore your life and to improve your quality of life. Without it, your life it can't move forward. So.
Yeah, just mention something else quickly, especially with mental health. So here at the Baltimore Station, our men, and this is very different than a lot of other programs, we offer therapeutic treatment modalities, or creative therapies is what we call them. So each day there's some type of activity going on, either art therapy, music therapy, we have a drama class, we have a diabetes instructor come in, we have a journaling class. If you come in and visit and see our schedule, it looks almost like a college curriculum, but the purpose of those modalities, obviously, they all tie back to recovery. They all have tremendous benefits for someone's mental health. And our goal is to replace negative behavior of drug and alcohol use with positive pro-social behaviors. And these are what I've personally seen here, especially with art and music. Men who come into our program might not be verbal. They might not be comfortable, sharing in front of a group or whatever their issues are, but you give them a pencil or a drum or a tambourine or something, and they are able to express and communicate that way. And we have seen tremendous results through those types of therapies.
So if I can ask for you, Kim, and for you, Shaquan, or anybody else on here, there's a common misconception that a therapist does every little level of mental health treatment, right? It's a big false stereotype out there. And a lot of therapists have, a certain expertise. It's just like medical doctors, right? You're not going to go to a PCP for your surgical services. You're going to go to the orthopedic surgeon, right? Same thing happens here. So I'm really curious what types of specific mental health needs you guys are seeing out of Baltimore Station and MCVET, perhaps maybe where the community here can come together to support you guys there and fill those gaps some.
Let me think how to best word. What we're seeing is, again, a lot of men struggling from being isolated during the pandemic, even though we had to move our program off-site for 4 months during the height of the pandemic. So men weren't allowed to, be together for meals, to be together for groups. They spent a lot of time in a hotel room and on Zoom. So we are really trying to work through what that isolation felt like and what those men were experiencing. We obviously have a lot of our men deal with PTSD. And a lot of our men were actually traumatized before they even went into the military. So that's what what our mental health therapist is really getting at, the crux of kind of what did you experience and what trauma did you face as a youth or as a young adult, even before you went into the military, and kind of getting at that and then going from there.
Matt, just to piggyback, definitely just as our roles in agencies, we all play a role in the veterans' mental health. So I think that every interaction should be empathetic. We don't know what someone is going through. So I just think that we see a spike in definitely PTSD, some schizophrenia, some can be, it's like memory, dementia, sometimes depending on the age of the client, but they can be expressed in different ways. What I love about MCVET is we do have COVID protocols in place, but our clients have never been isolated unless they become infected with COVID-19. And we were utilizing the Lord Baltimore Hotel for isolation. But I think that with MCVET, we're community and we're never really separated, but we do practice, social distancing. So you always have those connections. We never really lost touch with our veterans during this pandemic, which is by the grace of God, that they needed that because some of our clients just couldn't stand being alone or away from family, not being able to see their children. And I think that with our visitation policy being at a halt right now, that kind of impacts some things because we had some veterans being visited, but we do allow them to go into the community, by following rules and things of that nature related to MCVET. So just staying and being a brotherhood and a sisterhood at our agency is definitely key to bringing an increase in mental health outcomes. So we definitely can't leave our veterans just, out in the open end without interacting with them. And that's on an everyday basis because our clients are housed at MCVET. So you see them every day. You get to interact every day. You get to meet their needs every day. So.
Yeah, and I think what I'm sure all of us on this call, understand is that, veterans need each other. They need us, obviously, but our veterans need the support, like I said a little bit ago, of each other. And our men really rely on that sense of community within the Baltimore station to stay on track and to just really have the support system besides what we offer professionally and through counseling and everything, but also with other veterans that are in the program. And it's incredible when a volunteer group comes in who are veterans. Now the men might not know that, but there's an instant connection. I don't know, it's amazing to see, but there's just an instant connection. And it's wonderful. It really is.
And before we wrap up, I just wanted to open up the floor generally. Does anyone have any resources to share from their own organizations that would be helpful to know? Or if you have a question about trying to find some resources for the clients you serve, I know the Veterans Treatment Court, maybe Justin has some things to share, or Mary or others. And also, if you haven't introduced yourself, I know we're almost at time, but feel free to introduce yourself in the chat if you join later.
Hi, I would like to introduce myself. I actually have a couple slides I could share. Take less than 3 minutes. May I? I'm with the Department of Labor.
Department of Labor?
Yes, my name is Mr. Tharp. First name is James. Let me see if I can share my
what would
screen.
you like to share?
It's some PowerPoint slides. Give me 1 sec. Can everyone see my screen?
Yes.
Okay. So this is just a quick overview. Like I said, I'm with the Department of Labor. My name is James Tharp. I'm, like I said, I've been with them now for about 3 years. Just a little bit about myself. I've served in the military with 3 different decades, different branches, human resources, personnel information systems management, now moving into staffing and recruiting or the veteran assistance, being a DVOT. So we have over 30 American Job Centers in the area here. Hopefully this is a little better. And we have 12 workforce programs. Some of the things that we do, outtake, intake, assessments. We also, one of the partners over at the treatment court, work with Easter Seals, just name a few, New Vision House of Hope. We also work with those guys. So some of the other things that we do, we provide referrals, career guidance, job listings. Job seekers can use some of the following equipment there in the corner. We have over, like I said, 30 job centers in the various surrounding Maryland area. Additional services when they come, we have accommodations just to help, vet people with disability or special needs. So these are some of the other things that we do, which I'm not gonna read all of them. So job features, things like that. We also have employer features. So they're definitely gonna be well taken care of. So what I do here, I'm the DVOT at the bottom there. Like I said, we have veterans with significant barriers to employment and help them get meaningful employment, provide a case management type, support. And we have also broader network of assistance, and we give them priority of service. And also, we have local veteran employment reps. They work with the employers in the community. So these are just some of the things I just wanted to share, and that's my time, I guess.
Thanks, James. And there was a question that popped up in the chat. Just wanted to make sure we can respond around the resource need that, was it Sandra, targeted case management resources. I don't know if you want to elaborate, Sandra.
I think her sound isn't working. So she's just been including.
Can you hear me?
Oh, we can hear you now. Yes.
Oh, awesome. Good morning, everyone. So I'm with the Stephen A. Cohen Military Family Clinic. So this is my first time joining this collaborative meeting, which I am excited to be a part of. Currently, what I am seeking, and maybe you all may know of some resources, I have a veteran. She's in her 50s, but she does have quite a few needs. She lives in the Baltimore area, and she needs to be connected with just a variety of resources. So I'm thinking like targeted case management services will be great for her because she needs that little bit more attention and care instead of just trying to direct her independently. She actually needs someone to show her how to do certain functions and certain things.
Well, is Daryl still on? Oh, sorry, Mary. Go, Mary.
So I used to work in Baltimore, and I worked for Baltimore Crisis Response, and I was the veteran case manager there. So I provided targeted case management services. I'm pretty sure they're still doing it. So Baltimore Crisis Response, Inc. I'm pretty sure that they're still doing that kind of work. They did have somebody who was, I think we had a grant to assist veterans. And so I was a part of that. So I left in 2017. I'm pretty sure they're still doing that kind of work.
Wonderful. And that's the Baltimore Crisis, Inc., you said?
Baltimore Crisis Response, Inc.
Thank you.
And Sandra, you feel free to connect him as well to our team at Serving Together if you need some additional, resources and ideas. We're happy to connect with you offline too.
Thank you.
Absolutely. Awesome. Well, I know we're getting close to just a few minutes left. I want to save some time for Matt to go over a couple of items about hierarchy of needs. I'm going to kick it over to him. Let me get the screen up really quick.
No problem. So for those of you who don't know, I'm a huge Maslow's hierarchy of needs nerd. If there is such a title, I'm officially claiming that title. So I've been doing a lot of different veterans work for years now. I've been in the nonprofit human service industry for about 12 years now. And everywhere I go, I see Maslow's hierarchy of needs just popping up and literally, well, not literally, but metaphorically kicking me right in the teeth every day, right? So where am I going with this, right? We've heard today from Baltimore Station and MCVET, but also with Dr. X and Uplift and all these other fantastic orgs, but we all interface in all of these areas in some level here. In fact, Shaquan even said all systems impact one another here, going through Dr. X's piece there. And this is it, right? For those of you who are unfamiliar with Maslow's hierarchy of needs, it's simple. Follow the pyramid from bottom to top. So the basic of needs or social determinants of health are the basic things on the bottom, such as, food, water, things like that. And then you build your way up through life, all the way up to self-actualization or self-fulfillment, right? And what's interesting, because this is Mental Health Awareness Month, it's really defined as psychological needs right there in the middle. But what we've really heard is there's a difference between what's on paper and then reality. We've heard from MCVET and Baltimore Station and Dr. X, and from all of us here, that psychological needs really are at every level here. Mental health is not just meaning you're, air quotes, crazy, right? Mental health is everything. It's trauma, it's depression, it's anxiety, it's, oh my God, I have a crappy day at work, you know, or my family is giving me a hard time here, or I'm having no sleep because I got a newborn. You know, a couple of us here have unfortunately been going through that the last year. So mental health really is everything. And let's be real about our true mental health here. We can have our own different layers, our own different needs here, just like mental health interfaces here as well. So let's kind of break that stigma that mental health is just for, you know, the people on Wall Street who have too much hard work, or you're broken, or you're crazy, right? Mental health means you're all over the place and you're just scrambled in your head and you just need a little help organizing that. Doesn't mean you're broken at all. So Christy, going ahead, if we can, I found this next pyramid very interesting. So I found this pyramid here showing like a mental health hierarchy of needs. So this simply is, you know, again, the very basic things where your biggest demand for true mental health in its own hierarchy of needs is going to be at the bottom, and then you kind of build and build all the way up to that self-sustainment or self-actualization here. So what I really want to point out is look at all these different layers, right? Dr. X really started with different pain points versus how we use different needs or different wants, right? Pain points bring in one layer, and then recognizing your needs brings in another layer, and then bringing in, you know, your wants is a whole another layer of mental health. But the genesis of all mental health work really starts at the bottom here with help and support, which, you know, is going to be the foundation of everything. You know, you go to any AA, NA program, the step one is always going to be recognize that you have a problem, or recognize that you need that help. So we got to begin with that. And wherever you are at, wherever your colleagues or your clients are at, recognize it, or help them recognize that, hey, let's think about this. Let's talk about this. Just like we heard that Baltimore Station and MCVET are doing every day with their clients, where they have PTS or they have schizophrenia. Know what I'm saying? They have it, and they're not defined by their mental health. In other words, they have schizophrenia. They are not schizophrenic, right? Don't let mental health define you. Let you define what you have, if that makes some sense there as well. So one thing I really want to inquire about, and I'll just do this hypothetical here, or you know, just for you to think and chew on, is where do you really see the barriers in stigma in mental health? You know, if you think about that just for a few seconds, where are you seeing the stigma and the barriers to getting quality or good mental health treatments, or any mental health treatment? A lot of people are going to say the bottom two layers, right? Finding the help, or recognizing that you need help and support, and then finding the proper treatment, right? But I'll make a counter argument here that barriers and stigma are in every single level of this, right? We're always comparing ourselves to each other in society. We are always being inundated with this in society by performance of everybody else as well. So wherever you are at, wherever your clients are at, let's be aware of where we're going, so we can reduce those pain points, so we could treat people holistically, just like we all are doing here. So with that, that's Maslow's hierarchy of needs minute here. So let's get at it one person at a time, one thought at a time, and one brain at a time. So with that said, Christy, I'll pass it over to you here for the next piece.
Thank you so much, Matt. And this has been a great discussion. I know we're right at time, so I just want to send a quick reminder about Serving Together's peer navigation services. You know, we provide kind of that basic review, do a really thorough intake with our clients to help understand all their needs, really peel back a lot of those layers, and even ask questions specifically about mental health to connect them to appropriate resources in the region. So I'll keep moving, but if there's any support that you guys ever need, we do have a Get Connected form on our website, servingtogetherproject.org. We have our peer navigators. We have a phone line as well as our email address that you can reach out to them or myself or any of our team members. You guys got to meet Darrell earlier. He's just one of our team. We have a few other ones that are working diligently to help our military and veteran community. So feel free to connect with us if you have any support or resources that you need resources for. Our next meeting is going to be June 22nd. It is PTSD Awareness Month. We're going to have a presentation from Matt with Headstrong, and myself will be providing some more information on mental health and awareness, especially revolving around PTSD. And then July 27th, we'll be talking about veterans benefits. We'll be talking about what those speakers will be as we get them booked and lined up for the meeting. So we hope you will all join us then. Thank you all for participating today, and we hope that you have a great rest of your day.
Thank you. Bye, everybody.
Bye, everybody.